Hello everyone and welcome to my channel. My name is Maria and I'm a registered nurse. In this video, I'm going to be talking about my experience in terms of going back to university whilst also working part-time as a registered nurse. Post-registration nursing studies. That's what this video is going to be about. This video is kind of overdue because I did finish the course about 2 to 3 months ago. Nonetheless, I want to come on here and make this video as informative as possible. In this video, we're going to cover the who, what, when, where, how and why. How much did it cost, what course I studied, tips and advice in terms of if you want to do the same thing, lectures, seminars, e-learning, anything I had to do with my managers, all of that stuff. I do have some notes here. Again, I want to make this video as informative as possible. If there is anything that I've missed, then make sure you leave a comment or a question in the comments box below. If there are like a whole bunch of questions that people still have, then I may do a follow-up video. But if there aren't too many questions, then I'll just reply to your comment or your question in the comments box below. So some of you may be thinking, post-registration nursing studies, did you go back to university full-time? Did you go back to university part-time? Was it like a CPD? What exactly did you do? So what I studied was a CPD. CPD stands for Continuing Professional Development. It's how nurses and midwives maintain, improve and broaden their knowledge, expertise and competence and develop the personal and professional qualities required throughout their professional lives. I studied a total of 40 modules at a university in London. If I decided to do more modules, then I could add all those modules together and then finish with a master's degree, but really there wasn't the bandwidth to do that. First things first, what did I study? I studied a level 6 course, Care of the Critically Ill Adult. I did not go back to university on a full-time basis. I went on a part-time basis. And when I say part-time basis, I was probably attending online lecturers maybe 2 or 3 times a month. So the next question is, how did you find this course? How did you go about it? And if I'm going to be completely honest, it wasn't one of those things that I was looking for. At the time, I was working part-time as a nurse, and I remember one day logging into my email and I saw an email from my manager. He sent the email to me and he sent the email to about 5 other colleagues, and the overall, I don't know, gist of the email was, hey, I've enrolled some of you guys to a university degree at university. You'll be studying 20, 40, 60 credits. Please can you enroll, enter your details so that you can start when the course actually starts. And I was like, oh, I never mentioned anything about wanting to sign on to a course. And the last kind of serious conversation I had with my manager at the time was about leaving. So I wasn't really sure where this was going. At this point, I was kind of unsure of my nursing career. I wasn't sure if I was gonna, work as a nurse in this capacity or if I wanted to move into a different area of healthcare while still maintaining my nursing registration. I wasn't completely sure. So how it came about was, to me, kind of random, but obviously it worked as a blessing in disguise. Initially, I had been signed on to an infection control and prevention course. Me being nosy, I kind of scrolled down the table a bit more. There was my name and about 5 other people's names, and I saw what courses my manager had signed them up to attend. Some of them was Care of the Critically Ill Adult, some of it was cardiac care, some of it was elderly nursing, some of it was infection prevention and control like me, just a whole bunch of random courses. Like I said, mine was infection control and prevention. So I looked at the email and I was like, oh, this is pretty cool. Like, I don't mind doing this. I'm going to be here for, another 6 to 9 months. That's completely fine. I spoke to a handful of senior nurses, band 6s, band 7s. I don't think I spoke to any band 8s about it, but mostly 6s and 7s. And I said, hey, ex-manager has signed me onto this infection and control prevention course. What do you recommend in terms of my career, in terms of my progression? Do you think this is a good idea? And they were all like, yeah, this is a good idea. And then when I mentioned that some of the colleagues had been placed onto the Care of the Critically Ill Adult or the HDU course, and I said, what course do you think is better? Should I stay on infection control? Do you think I should do HDU? Do you think I should do, this other course? Pretty much all of them said critical care, HDU, high dependency. That is what I would recommend regardless of what area of nursing you want to move into. So obviously I took their advice and I approached my manager and said, hey, I appreciate you've put me on the infection control and prevention course. However, speaking to band 6s and band 7s who work within this hospital, based off what I've told them in terms of my career and, moving into different areas of healthcare, all of them have recommended critical care course, HDU course, some sort of high acuity, high dependency care course. So I said this to my manager and he was like, okay, this is fine. I'm gonna try my hardest to convert your program to the HDU or the critical care course. However, the critical care course, I think he said it costs more, or he said something along the lines of, I'm gonna need more money to fund this course. And I was like, you know what, it's okay, do what you can do, and that's fine. And then, I don't know, he did something, and then I was placed on the HDU. I'm using HDU and critical care. I'm just gonna say HDU because it runs off my tongue easier. But yeah, he did something behind the scenes, and then I was placed onto the HDU course. Course is effort, time and money, so that's something that I had to think about. When I was put on the course, yes, I was happy, but it wasn't a case of, oh my gosh, I'm going to do this straight away. You have to consider the fact that you're not just a nurse, there are other stuff going on. And when I saw the course, my mind just went back to my 4-year undergraduate nursing degree, and I was like, is it going to be as intensive as that degree? Because if it is, I'm really going to have to consider if this is what I want to do. I've also put down, it has to be aligned with my future. So another thing that I did, alongside speaking with band 6 and band 7 registered nurses or healthcare professionals, another thing I did was really considered my future in nursing, considered my future in healthcare. And one thing I'll recommend to everyone, not just if you're a nurse or a doctor or whatever, look at where you're at, look at the next position above, look at jobs for the next position above, look at the job requirement, look at the job description, and pretty much all of them said must have some CPD course, must have a HDU course, must have evidence of additional nursing knowledge at a university. So this was kind of like a no-brainer. Regardless of whether I was going to stay here or go elsewhere, I knew that I was going to move up, and most of the positions that I was, you know, kind of had at the back of my head in terms of this is where I want to go, all of them said CPD or level 6, level 7 in HDU critical care. So that's what I decided to go with. So I went back to my manager. He changed my course from infection prevention and control over to the care of the critically ill, the HDU course, which was really good. So once he'd done that, the next thing for me was terms, conditions, costs, and logistics. Costs. So it wasn't really the monetary value in terms of, is it going to cost £1,000, £2,000? That's not what I was concerned with. What I was concerned with was the time, because I know some universities or some healthcare businesses or the NHS, they may say, hey, we're going to pay for you to do this course. However, once you finish this course, you have to work with us as a full-time nurse for the next year, for the next 2 years. I didn't want to be tied down. And I made it very clear to my manager that if I'm going to do this course, I'd rather pay for it outright and be free to do what I want to do afterwards. I don't want to be in a position where I sign onto the course, attend the course, and then I'm tied down to this trust. Nothing to do with the trust, but I just like to know that I can move as freely as I can. The world is my oyster, and I don't want to be tied down by a course that I easily could have paid off by myself. And he said, no, don't worry, you can do this course. If you decide to leave, you know, a day after the course is finished, that's completely fine. So I was cool. So that was the first thing that I was concerned about. The second thing that I was concerned about was the logistics of everything. How will it work? And I didn't want to be in a position where I was coming into work 2 days a week and then I had to attend lecturers or seminars or e-learning groups once a week, twice a week. I didn't want that to be the situation. And he basically said, at my trust, I was kind of already aware of the policy, but at the trust that I used to work at, you could apply for up to 10 study days. So I just made sure I used my study days, so I was never working over or under my contracted part-time hours. So logistically, it worked completely fine. Obviously, I was doing my course during the pandemic. In normal circumstances, me and my course mates would go to university, study, come home, do our homework, whatever, all of that stuff. But because of the pandemic, everything was online. When I say everything, our exams were online, our practical OSCEs were online, essay submission was online, as would have been the case before the pandemic, but absolutely everything was online. Not once did I actually step in to the university. Some people don't like online learning. I don't mind, given the circumstances that we were in at the time. And I know I said I was working part-time. Yes, my contracted hours were part-time. However, I was doing a lot of overtime shifts. On top of that, for about 3 to 4 months, I was living in a hotel in central London just to try and help keep up with the pandemic effort. So I did find it very beneficial to have all of the courses, the lectures, the seminars, all of it online via Zoom. At the time, I was very grateful. I wouldn't have had it any other way. So let's go into the specific modules, and the course consisted of 3 main assessments, and the first one was an OSCE analysis. This was 1,500 words, and we basically had to critically analyze on OSCE, demonstrate an accurate systematic patient assessment, deterioration of risk, care escalation in an appropriate manner with clear recognition of appropriate investigations and initial interventions for the critically unwell adult. Basically what we did in the actual final exam, we were presented with a critically unwell adult. We basically had to go through everything that we would do in terms of A to B assessment, tests that we would order, any relevant assessments we would do, how we would interpret the results. That was one part of it. And then the next part was the 1,500 word essay, where we were basically evaluating and justifying and providing a rationale for why we did certain stuff or why we didn't do certain stuff for this critically unwell adult. So that was kind of that assessment, that OSCE analysis. The next assessment we had was a case study. This was 2,500 words. Basically what we had to do was go out into our practice environment, identify a critically unwell adult, and then write a 2,000 word essay providing a justification, a rationale for how that patient may have come to be in that critically unwell position, and then justify our actions in terms of I did this because I didn't do this because based on the data of this, based on the law of this, this is what I did. And that was 2,500 words. And then the final assessment we had was a practice assessment where we had clinical competencies that we had to get signed off by a named mentor in our practice environment. Some were essential and some were optional. We had the OSCE analysis, we had the case study, and we also had practice assessment clinical competencies. Overall, in terms of the online lectures, the online seminars that we had, it consisted of group discussions, PowerPoint presentations, study days, with a focus on respiratory physiology, fluid electrolyte balance, ECG rhythm interpretation, vasoactive support. We literally covered everything, all the basics of everything kind of cardiology, respiratory, because that's what I don't want to say I specialize in because I'm not an advanced nurse practitioner, but I did spend most of my time on the cardiology wards. And then obviously when the pandemic came around, me and the ward, my team, I guess, we were doing a bit of respiratory as well. The challenges, I feel like this bit was important. Challenges, one was motivation levels. Like I said, even though I was contracted to work part-time hours, there were weeks where I was doing like 4 night shifts. There were weeks where I was doing like up to 5. I think maybe, yeah, I don't think I did anything more than 5 shifts a week. So sometimes I just wasn't motivated to do it. You'd come back from a 13-hour shift and you're thinking, okay, now I've got to work on this essay. You've come back from a 13-hour night shift or whatever hour night shift, and you're thinking, oh my gosh, I have an OSCE the next day. My OSCE was in my hotel room. My OSCE was in my hotel room. I remember having my computer up, me being sat on my bed because the way the lighting was, it wouldn't have worked if I had the camera and I was sat at the desk. Me literally being sat in the bed, and then the assessor was like, hey, can you show me where you are? Obviously just to make sure you're not cheating. And I had to show him the room, and I said to him, I'm so sorry, but I've been living out of a hotel. And he was like, no, it's fine, I completely understand. You know, loads of people living out of hotels, living in random places just to help keep up with the pandemic efforts. So yeah, motivation levels was a serious thing. Luckily for me, some of the people who were on the course with me were colleagues that I actually worked with. So it was so great where, you know, after you had a long day at work or after you've been working through the night to try and submit your essay, going into work the next day or the next week or whatever, and seeing colleagues that you actually work with as well. So it was really good to catch up, help each other out, help to kind of consolidate our learning, help to kind of clarify or re-clarify any issues that we may have had. So yeah, motivation was definitely a thing, and I'm not sure if everyone actually finished the course. The hardest one to achieve was the clinical competencies. There is no way I'm gonna have 2 patients in front of me that are both very unwell, and I'm interpreting blood gases, and I'm gonna go to the band 7 or band 8, hey, can you quickly sign this competency for me? There was no way that was gonna happen. So that was not only the hardest for me, but other classmates, they also mentioned getting their clinical competencies was the hardest thing. Not because they couldn't do it, was because it was simply simply because of the time constraints. But what I did for some of my competencies was that after a night shift, I know it wasn't ideal, I did recommend it to some of my other course mates and they were like, forget it, after night shift I'm going home. But what I did for a couple of my night shifts was that when I finished my night shift, I'd go downstairs to the canteen, have some breakfast, you know, wash my face, get changed to my normal clothes, and then I'd go back onto HDU, meet with the practice educator on HDU and be like, I've just finished the night shift, please can we sit down and sign off, you know, 1 or 2 competencies. And because I just finished a night shift, they were more inclined to be like, okay, let's do what we need to do, let's sit down for 10 minutes. And because the competencies were quite long, like I think it was about 10 to 12 competencies, but each competency could have like maybe 10 to 20 points. So I would say to them, I'm not trying to get everything signed off right now because I'm knackered and I know for you it's going to get very busy very quickly. However, can we just spend, even if it's just 10 minutes, going through 1 or 2 sections of this? And I found doing this every so often meant that I was able to get my competency signed off bit by bit by bit. If you are doing a university degree or doing like a CPD on a part-time basis and you have to have competency signed off, do not leave it to the last minute because that's just the worst thing. And when you are having your competency signed off, make sure you get it signed off by the right person. Challenges, number 1 was motivation levels, number 2 was getting your clinical competencies signed off by the right person. The third challenge was moving to a new area. Now, it wasn't really a challenge, but it was just something to consider. Initially, I was working ward level, so level 1. However, in order for me to achieve these competencies, I had to move to a level 2 area, which I completely understood. There's no way you're going to do a HDU course but be based in ward areas. Like, that just doesn't make sense. So for some people that may be a challenge in terms of moving into new areas, but for me, I think I'm quite a happy-go-lucky person. Not that I'm happy to go to anywhere, because trust me, I'm not happy to be moved to any ward. But if it's something that I've signed up for and said, this is what I want to do, then I will take whatever comes with it. And yeah, like I said, there's no way you can do a HDU course and stay on the ward. Like, you need to move to a HDU area. So that was fine. In terms of like meeting new people, working with different types of people, completely fine. That really wasn't a concern for me, but I just put it down in the challenges section because I'm sure some people might find it challenging to move from one team into another team. Next challenge that I really experienced was rostering. Rostering was complicated back and forth with the wards. The rostering wasn't working. Sometimes I'd come up to work, they didn't know I was supposed to be there. That's about me and my story, me and my experience in terms of going back to university as a post-registrant nursing student, CPD study, HDU course, care of the critically ill adult, 40 credits, passed. Hallelujah. Thank you guys for watching this video. If you have any questions, make sure you put it in the comments box below. Any comments, if you want me to clarify anything, let me know. If I get so many comments or questions where I feel like I need to do a follow-up video, I will. If not, I'll just answer your comments, questions, query in the box below. Thank you guys for watching, and I'll see you guys in my next video. Bye.